Welcome to the deep dive. Today we're jumping into a topic that's, well, it's not just knocking on the door anymore. It's practically remodeling the house of modern medicine, AI in healthcare.
Right.
And for you, heading into the medical field, getting a handle on this isn't just good to know. It's really about understanding the tools that are going to shape how you practice.
Absolutely. It's fundamental now. We've gathered quite a bit of material here, case studies from hospitals actually using this stuff, pharmaceutical companies, broader looks at clinical use, ethical deep dives too.
Yeah, real mix.
The idea is to give you a clear, practical overview of what AI is doing right now.
Exactly. So our mission for this deep dive, thinking specifically about your perspective as a medical student, is to pull out the essentials. We want you to walk away with a good feel for how AI is being used today, its potential, the real world challenges, and the basic ideas behind it all.
Ready to get started.
Let's do it. Where's a good place to begin? Maybe with how it's actually being used now in hospitals.
Perfect. Let's look at some real-world examples because things are moving fast. It's pretty impressive, actually.
Like HCA Healthcare. They're using something called Azra AI. Now think about the sheer number of pathology reports, radiology reports. It's huge, right?
Oh, absolutely. Mountains of data.
So this AI goes through them, flags potential cancer cases, often much earlier than just relying on manual review. That's a big shift.
It is. And it's not just about speed. It helps automate the cancer registry input, filling in over 50 fields automatically. Think about the time saved and, crucially, the reduction in potential human error.
That's huge for data accuracy. And it plugs right into their electronic health record system, MedTech in their case, feeding info straight to the nurse navigators.
Which streamlines things enormously for those teams guiding patients through, a really difficult process.
Definitely. And it's not just cancer detection. Look at university hospitals. They brought in ADOC's iOS.
Ah, yes, ADOC. They focus heavily on image analysis.
Right. CT scans, X-rays. The AI looks for critical findings, things like a pneumothorax, pulmonary embolism, aortic dissection, things you need to know about fast.
And the key benefit there is prioritization. In a busy ER or radiology department, it flags the urgent cases. So radiologists see the most critical scans first.
Which directly impacts patient outcomes, doesn't it? Getting that rapid red, flagging those conditions immediately.
Absolutely. And ADOC also pulls together patient data centrally. So everyone involved in the patient's care gets the full picture faster, speeding up diagnosis and treatment decisions.
Okay, so diagnostics is a big one. What about just running the hospital? Operations.
Good question. Duke Health is a great example here. They're using GE Healthcare's command center software. Imagine like a mission control for the hospital.
Yep.
It tracks patient flow, bed availability, staffing, all in real time. And it uses historical data to predict future needs, identify bottlenecks before they become major jams.
So it's proactive, not just reactive.
Exactly. And the results they reported are pretty striking. A 6% productivity increase, cutting temporary labor needs by half.
Wow.
And getting patients assigned a bed 66% faster. That's a massive improvement in efficiency and patient experience.
That really changes the dynamic on the floor.
Yeah.
And it's not just the huge university hospitals, right? You mentioned a group in Austria.
Diagnosticum, yeah. A radiology group using AI to cope with rising workloads and staff shortages, particularly for complex things like breast cancer, screening MRI, mammography.
So it's a practical tool for addressing real-world resource issues that, well, you're likely to encounter too.
Precisely. It's not just academic theory. It's being deployed to solve everyday problems in clinical settings.
Now, thinking about the treatments you might prescribe someday. Pharmaceuticals. How's AI changing things there? Sanofi, for instance, is working with biotech firms.
Right. AI and drug discovery is a huge area. The potential is enormous for speeding things up. AI can analyze massive data sets, genomic data, clinical trial results, scientific literature to identify promising drug candidates much faster than traditional methods.
So finding new drug targets.
Finding targets, predicting how effective a molecule might be, even helping design new drugs. And Sanofi's also using it internally, like predicting inventory shortages for existing drugs or optimizing manufacturing, practical stuff.
Makes sense. And what about the physical hospital itself? robotics.
Yeah, Humber River Health in Canada is a fascinating case. They call themselves the first fully digital hospital. They use robotics extensively, like the Da Vinci surgical system.
For minimally invasive surgery.
Exactly. It offers greater precision, potentially faster recovery, and it opens doors for things like remote surgery too, extending specialized care. These systems often use AI for guidance and analysis, enhancing the surgeon's capabilities.
Interesting. And Boston Children's Hospital, they seem to be doing a lot.
They really are. They developed a predictive model called POPP, prediction of patient placement. It forecasts emergency department admissions with over 90% accuracy.
90%. That's incredible.
It allows them to get resources ready before the surge hits. Think about staffing, bed allocation. It makes the whole system run smoother.
That's huge for managing hospital resources effectively.
And they're doing more using machine learning for tracking infectious diseases like RSV and influenza, even developing language models so nurses can quickly look up clinical policies. They even built a bot builder so different departments can create their own simple AI tools.
That really shows how it's becoming more integrated, more accessible within the hospital system itself.
Definitely.
Okay, so we've seen AI in diagnostics, operations, pharma, robotics. It's really spreading out. Now, you hear the term deep learning a lot.
Yeah.
As a medical student, what does that actually mean in this context?
Good question. Deep learning is basically a type of machine learning that uses artificial neural networks with many, many layers, hence deep. These layers allow it to learn really complex patterns from vast amounts of data.
Like medical images.
Exactly. Convolutional neural networks, or CNNs, are a specific type of deep learning architecture that's particularly good at analyzing visual data, like X-rays or CT scans. They learn to recognize features hierarchically, from simple edges to complex structures. That's why they're so effective in tools like ADOC system.
Okay. And there are different ways these networks learn, supervised versus unsupervised.
Right. Supervised learning is like teaching the AI with labeled examples. You show it thousands of chest x-rays already marked as pneumonia or no pneumonia. Then it learns to predict that label on new, unseen x-rays.
Makes sense, like flashcards for the AI.
Kind of, yeah. Unsupervised learning is different. You give the AI a whole bunch of data without labels, and it tries to find hidden structures or patterns on its own. Maybe clustering patients based on subtle genetic markers you didn't even know were linked?
Interesting. So uncovering new insights, potentially.
Potentially, yes.
Now, shifting focus a bit, mental health. That seems like a really sensitive area for AI. What's happening there?
It's definitely being explored cautiously. Researchers are looking at conversational AI chatbots, basically to maybe supplement online support groups or even help screen for conditions like depression. Some are exploring delivering parts of cognitive behavior therapy via AI.
Like a digital assistant for mental wellness.
Sort of. And also, AI can help human moderators in those online communities by scanning posts for sentiment, flagging potential crises that need urgent human attention.
That could be really valuable for providing timely support.
It could. And then there's natural language processing, NLP, analyzing text. People are studying whether NLP applied to electronic health records like doctor's notes can pick up linguistic cues that might predict risk of suicide or accidental death after someone leaves the hospital.
Wow. That's powerful, but obviously carries huge ethical weight.
Absolutely. Huge.
What about chronic conditions? Diabetes is so common. How's AI helping there?
Well, AI models, neural networks again, are being used to create better prediabetes screening tools. They can analyze factors like family history, weight, activity levels, things easily collected, and spot complex relationships that might indicate high risk better than simpler formulas.
So earlier identification of at-risk individuals.
Exactly. And AI is also linking up with wearable glucose monitors and insulin pumps, helping with self-management, remote monitoring by clinicians, maybe even adjusting insulin delivery automatically in the future. The hope is better control, fewer complications, and maybe fewer routine clinic visits.
Reducing the burden on both patients and the healthcare system.
That's the goal. Improved accuracy, better risk prediction, potentially lower costs.
And thinking bigger picture, public health, protecting whole populations.
AI is definitely playing a role in disease surveillance. It can automatically span news reports, social media, ER data streams from all over the world to detect potential outbreaks way faster than humans could manage alone.
Like an early warning system.
Precisely. The Global Public Health Intelligence Network was an early pioneer here, credited with helping spot SARS early on. AI can also broaden how we track things like the flu and help pinpoint specific communities most at risk for chronic diseases like heart disease or diabetes, so public health efforts can be targeted more effectively.
Okay, so its reach is really broad. Let's circle back to diagnostics, specifically radiology. As a future doctor looking at images, what AI tools might you encounter?
We're seeing AI diagnostic tools emerge, even sophisticated chatbots like ChatGPT, the GPT-4 version, especially being tested on analyzing X-rays and giving preliminary reads.
Right, I saw a study looking at that, ChatGPT analyzing skeletal and chest x-rays. How did it do?
It was mixed, really. Sometimes correct, sometimes partially correct, sometimes just wrong. It often suggested several possibilities, which shows some knowledge, but it struggled with subtleties like tiny fractures.
So definitely not ready to take over from a radiologist.
Not at all. It highlights that right now, AI is an assistant. It needs human confirmation, human clinical judgment. You, as the physician, still need to critically evaluate everything.
That's a really important point. It's a tool, not the decision maker.
Exactly. And its strengths are speed and access to vast knowledge. But it lacks clinical experience, the intuition, the ability to synthesize everything about the patient that a human expert does.
And different AI models will likely perform differently, right? The studies suggested newer versions like GPT-4 might be better.
Yes, performance varies, and the technology is constantly improving. That's why ongoing research and validation are crucial. The examples in that study were telling it might spot an enlarged heart shadow but misinterpret the specific lung issue, for example.
But despite those limitations, there's real progress being made in radiology AI, isn't there? Specific algorithms are getting quite good.
Oh, definitely. Algorithms like ChexNext have shown performance on par with human radiologists for certain tasks on chest x-rays. Deep learning models are very successful at classifying lung nodules. AI is also being used to improve image quality itself, making scans clearer and even showing promise in predicting Alzheimer's risk from MRI scans years in advance.
So the potential for earlier diagnosis is definitely there.
It is, identifying subtle patterns humans might miss, but again, it needs careful integration, validation, and understanding its limits.
Okay, so putting it all together, how can you, our medical student listener, actually use AI in your future practice?
Well, diagnostics, as we've discussed, AI can be a powerful reference tool. You input symptoms, history, demographics, and it can suggest possibilities, maybe things you hadn't initially considered. That Stanford study on skin cancer showed AI improving diagnostic accuracy as an adjunct to the physician.
So like a sophisticated differential diagnosis generator.
In a way, yes. Then there's personalized medicine. This is really exciting. AI can analyze a patient's specific data, genetics, lifestyle, past responses, compare it to thousands of similar patients, and help tailor treatment plans that are more likely to work for that specific individual.
Moving beyond one size fits all.
Exactly. And continuous care. Imagine AI tools helping patients manage chronic conditions between visits, answering questions, monitoring data from wearables, maybe flagging issues that need your attention. Plus, AI can help generate patient education materials in plain language.
That could really improve patient engagement and understanding. And what about the paperwork, the admin burden?
Huge potential here. AI can streamline scheduling, billing, record management, and automatic speech recognition AI dictation can transcribe your notes directly into the EHR. Think about the time that frees up. Less clicking, more caring. It could genuinely help reduce physician burnout, which the AMA highlights as a major issue.
That alone would be a massive win.
Absolutely. AI can also support your decision-making, suggesting appropriate tests based on guidelines, helping answer patient questions with up-to-date info. It might even help reduce cognitive biases, ensuring we don't miss things due to assumptions or shortcuts.
And we touched on drug discovery earlier. AI speeding up the pipeline means potentially getting new, effective drugs into your hands, into your patients, much faster and potentially cheaper.
Right. Cutting down that average decade-long, multi-billion-dollar process. Even getting to first-in-human trials maybe 40% faster, that's a significant acceleration.
Okay, this is all fascinating. To make sure we're all on the same page, maybe we should quickly define some of the core AI terms you'll keep hearing.
Good idea. Let's start with AI itself, artificial intelligence. The Oxford Dictionary basically says it's computer systems doing tasks that normally need human intelligence, like seeing, understanding language, making decisions, translating.
Pretty broad. And in healthcare, we hear about narrow versus general AI.
Yes. Almost everything we use today is artificial narrow intelligence, or ANI. It's AI designed for one specific task, reading x-rays, scheduling appointments, detecting cancer markers. It's very good at its job, but that's all it does.
Okay.
Artificial General Intelligence, AGI, is the more sci-fi concept, AI with human-like intelligence that can learn and reason across many different domains. It's theoretical right now, not something you'll encounter clinically anytime soon, so focus on ANI.
Got it. AI is the current reality. What about machine learning, ML?
ML is the engine behind much of ANI. It's how computers learn from data without being explicitly programmed for every scenario. Algorithms parse data, learn patterns, and make predictions. It's why AI keeps getting better. It learns from experience, essentially.
Okay. And natural language processing, NLP, we mentioned that.
Right, NLP is about computers understanding human language, text, and speech. Super important in healthcare for things like pulling structured data, like allergies or diagnoses, out of free text doctor's notes, or understanding dictated reports. A lot of NLP uses ML algorithms underneath.
Makes sense. And finally, CAD, computer-aided detection.
CAD systems are common in imaging, like radiology or dermatology. They're trained on thousands of images to spot potential abnormalities, like a suspicious mole or a lung nodule. They act like a second reader, highlighting areas for the clinician to review closely. They don't make the diagnosis, but they help focus attention.
Okay, that clarifies those key terms.
Okay.
So we have these powerful tools being implemented, but this inevitably brings up some serious ethical questions, doesn't it?
Absolutely. This is critically important. We have to think about the core principles. Beneficence acting in the patient's best interest, non-maleficence avoiding harm, autonomy respecting patient choice and informed consent, and justice, fairness in access and avoiding bias.
How do those apply to AI specifically? What are the big challenges?
Well, first, privacy and data security. AI needs vast amounts of patient data to learn. How do we protect that sensitive information? That's paramount.
Right. And then there's bias. If the data used to train the AI reflects existing health disparities.
The AI can actually perpetuate or even amplify those biases. It might perform worse for certain demographic groups, leading to inequitable care. This is a huge concern we need to actively address.
How do we even know how the AI reaches a decision? The black box problem.
Exactly. Transparency is crucial. If clinicians don't understand at some level why the AI is suggesting something, it's hard to trust it or spot potential errors. We need interpretable AI where possible.
And rigorous testing.
Right.
Clinical validation.
Absolutely critical. These tools need to be thoroughly tested for safety and effectiveness in real-world clinical settings before they're widely adopted. You wouldn't use a new drug without solid trial data. The same applies here.
So who's responsible when something goes wrong?
Yeah.
If an AI makes a mistake?
That's the accountability question. Is it the developer, the hospital that implemented it, the clinician who acted on the recommendation? We need clear lines of responsibility involving all stakeholders. And ultimately, professional responsibility remains key. You, the clinician, need to critically evaluate AI output and prioritize your patient's well-being, even if it means overriding the AI.
That's a heavy responsibility.
Yeah.
How do we prepare clinicians for this?
Training is essential. It needs to be part of medical education, continuing professional development, understanding how AI works, its limitations, potential biases. That's becoming a core competency.
And access to AI systems that are as transparent as possible.
Yes, fostering trust and allowing clinicians to actually evaluate the outputs properly. Plus, ongoing evaluation and improvement with clinician input is vital. This isn't a one-and-done implementation.
So lots of ongoing work needed on the ethical and practical integration fronts.
Definitely. Future research needs to involve everyone: patients, doctors, developers, policymakers. We need long-term studies on impact, deep dives into ethics, comparisons between different AI tools, and specifically exploring how AI could maybe even reduce health disparities if designed and used thoughtfully.
It's a complex picture, but undeniably transformative.
It really is.
So wrapping this up for you, our listener heading into medicine. AI is here, it's growing fast, and it's touching almost every aspect of healthcare diagnostics, treatment, how hospitals run, even how new drugs are made.
The potential benefits for efficiency, accuracy, and ultimately patient outcomes are huge. But, and this is a big but, realizing that potential means navigating those ethical challenges very carefully. Bias, privacy, accountability, these aren't afterthoughts.
Right. It needs a collaborative approach. Clinicians like you, technologists, ethicists, patients, policymakers, everyone needs to be part of the conversation.
As a future physician, you're going to be right there on the front lines of this shift. Understanding both the clinical power and the ethical nuances of AI is going to be absolutely crucial.
Your role will be key in making sure this powerful technology enhances care, makes it more equitable, but never replaces the essential human elements, compassion, judgment, and that core commitment to the patient.
Keep learning, keep questioning, and think about how you can help shape this future responsibly.
Thanks for joining us for this deep dive into AI in healthcare. We hope this gives you a solid foundation as you move forward in your medical journey.